I'm author and journalist Maia Szalavitz, and I co-founded Changing the Narrative because I got tired of the media being a conduit for misinformation. Most people get their information about addiction from the media, but many journalists don't know about the racist history of our drug laws or their unscientific nature. They think that the overdose crisis was driven by pain patients getting addicted, when in fact, most people who became addicted got their drugs from friends or family members. They think that exposure alone causes addiction and that it can happen in an instant. They think that addiction can turn ordinary folks into criminal zombies. If we actually want to destigmatize addiction, the public needs to know what it really is and how it happens. And in order to teach the public, we've got to first educate journalists to do better. And that's what we hope to do with Changing the Narrative. Thank you.
I got involved with Changing the Narrative because I'm a Black woman in recovery from substance use disorder. And I know all too well that stigma is a form of oppression. So language can either perpetuate it or it can educate to eliminate that kind of oppression.
I got involved with Changing the Narrative because as a writer and journalist, I believe in the power of language to shape our world. For decades, the media has labeled people who use drugs as addicts and drug abusers. But research shows that this language elicits negative attitudes, harsh judgments, and it even impacts people's health care. Humanizing people who have long been dehumanized is one of the founding principles of Changing the Narrative. In practice, this is actually quite simple, and everyone should be doing it. Instead of relying on outdated, stigmatizing language, we simply refer to people as people first. No one should be defined by their behaviors that stem from a mental illness. In working together, we've been able to tell more empathetic stories that truly change the way people think.
I'm here to talk about why we need to change the narrative when it comes to talking about drug use and addiction. We are in the midst of a massive public health crisis, the drug overdose crisis, which is predicted to have claimed more than 90,000 lives in the past 12 months. This has been driven by failed policy and inadequate access to effective treatment and effective care, largely driven by stigma and misunderstanding about drug use and addiction. During the time of COVID, we've seen overdose death rates surge. We've seen worsening racial disparities with rising rates of overdose deaths amongst Black and Latinx Americans. And we've been reminded of the health harms of living in a racist society. When it comes to drug policy and addiction treatment, policies in our country related to drug use have always been fueled by discrimination and by racism. It's time to change that narrative and to educate people about what works and what's effective. As evidence of how the narrative has malformed access to effective care, we've long known that medications like methadone and buprenorphine for opioid use disorder reduce the risk of death by more than 50%, and yet our policies limit access to care, and nearly 50% of U.S. counties don't have a single provider who can offer these medications. We continue to let myth and misunderstanding about drug use and addiction fuel our clinical care and the way we approach people who use drugs. Common myths and misunderstandings include the notion that all people who use certain types of drugs will develop addiction. For example, people who use opioids or cocaine as opposed to more socially sanctioned drugs like alcohol, or that tough love, treating people poorly, being hard on them, will actually help people get better, or that being kind or compassionate to a loved one or someone with addiction or a substance use disorder is actually enabling them or causing harm. We need to undo these harmful myths and let science and compassion guide our approaches. Through Changing the Narrative, we hope to challenge some of the most common myths and tropes about drug use and addiction to better inform the public, policymakers, clinicians, people working in the healthcare space, people working in law, policy, public health, and to generally change the way we think about and care for people who use drugs.
Just about everyone agrees that stigma is one of the biggest causes of continued growth in overdose rates and rates of addiction in America. But one of the blind spots is that the very point of criminal law is to stigmatize. So the continued criminalization of people who use drugs is a huge barrier to better policies and programming to prevent overdoses and improve treatment. That's why we fight to decriminalize drugs and decriminalize people who use drugs.